You know, what we're going to do is focus on healthcare reform. There'll be a number of different agreements that we have to look at, and there's going to be a lot of structural change that we need to make. And so I'm looking forward to working with Minister Jason Copping on making some significant changes to Alberta Health Services that are going to address the big problems that we have, which is the emergency response, our paramedic services, and making sure that we've got sufficient support in our rural hospitals. No, I've talked to Minister Copping about it. Anytime you get asked a question about that, you think of like the worst case scenario, a meteor strike happening in Alberta, right? And so I think he understands that in the context of COVID, we are not having restrictions again in the fall. We have now moved on after 2.5 years. We know a lot more about this virus. It has mutated. We have effective therapeutic treatments for it. There will be no restrictions related to COVID-19 in particular in the fall. He and I are in perfect alignment on that.
Sure. So was his comments not in regard to COVID-19, or have you guys talked since? And
it was not in regard to COVID-19. It was him imagining sort of a worst case scenario of some future point. It's and I know he is 100% on board with both the reforms for Alberta Health as well as making sure we do not have restrictions again in the fall.
When you talk about the pardons, for a lack of a better word, during COVID, does that apply to the people who were arrested in Coots?
I have to talk to, I'm getting some legal advice on who we might be able to issue pardons for, but the things that come to top of mind for me are people who got arrested as pastors, people who got arrested for not, or got given fines for not wearing masks. These are not things that are normal to get fines and get prosecuted for. So I'm going to look into the range of outstanding fines that there still are, and to get some legal advice on which ones we're able to cancel and provide amnesty for. Well, I guess the way I look at it is that a lot of the bad decisions that were made by Alberta Health Services and on the advice of bad advice from the Chief Medical Officer of Health. And we had a very new cabinet, very new premier, and they deferred to the experts, quite frankly, that were hired by the NDP government for the most part. We were told that we should defer to the experts, and they failed us. And so we are going to hold the people responsible who gave us that failure. And to me, we've already in our party gone through a process where we held the top person, the top decision maker to account. It's why we have a new leader. You will also see that there are a couple of people who are seen to be very close to him in implementing that plan, who are also taking a back seat for a time. But my sights are set on Alberta Health Services because I think that's where our biggest problems lie right now.